The Dow up for 5 straight days, over 7% on the week, the best weekly point gain all year. What's behind this rally and what Washington is doing that could derail it? But first, forcing Americans to sign on to government-run health care. And if you don't play, you'll pay. Big businesses opting out will see an 8% tax hike. Anyone else refusing it, a 2.5% penalty on your income. Now, some lawmakers say this puts us one big step closer to a healthier America. But are we really one step closer to the United Socialist States of America? Hi, everybody. I'm Brenda Butner. This is Bulls and Bears. Let's get right down to it. Here they are, the Bulls and Bears. You know them. Gary B. Smith, Tobin Smith, Pat Dorsey, along with Joe Patapaglia, and radio talk show host Mike Papantonio. Welcome to everybody. Okay, Gary B. So we're using this term loosely, but really, are we turning into the USSA?
Brenda, it sounds like hyperbole, but absolutely. Look, I can understand, and even there it's a stretch, but I can understand the government wanting to offer health insurance as an alternative, even though they haven't managed any health business effectively so far. But, all right, I'll give them that. But this cram-down, forced march into everyone must have health insurance, everyone must sign on to public or private, is absolutely ridiculous. Next it's going to be, you know, you must eat 3 servings of vegetables a day, you must get 30 minutes of exercise, and then it'll probably close the borders, won't let anyone leave if they don't like that, because they need the tax revenues. This is perfect for the Obama administration. One more check mark along the "we know better than you, America, and we will tell you what to do."
That might work for California, closing down the borders. A lot of people trying to leave there because of the tax problems. But, Mike, you say right now that you don't agree with this, that mandated health care is not a problem, huh?
Well, it's almost like Gary's never heard of the American Department of Veterans Affairs. I mean, it's been a socialized system we've had around for decades. For decades, government has
look
run
how great they've run those hospitals, Mike.
Gary,
just fantastic.
They've run 150 medical centers. They've run 140 nursing homes. They've employed 55,000 nurses, 14,000 doctors. And Gary B. here doesn't have any faith in government. Taxpayers pay for that system. And you know what, Gary? This might be a big shock to you, but the truth is Germany, France, Italy, Spain, the UK, Canada, all of those countries have the exact same system that we use for the American Department of Veterans Affairs. That might be a shock, but it's working.
But
it's
I'm
worked
not
for a long
so
time.
sure.
Let's go down that path like Europe. Perfect.
I'm not so sure that it would surprise us. Actually, most of the countries that he named, Joey B., are socialist countries.
Well, that's exactly right. And they've had this compact with the people.
They're not.
And the sacrifice they've made is for legitimate growth, legitimate entrepreneurship, and now you're turning what could be a privilege into an obligation. You're forcing employers to do and behave in a way to mend to the government, and at the same time, you're forcing individuals to sign on for health care whether they want it or not. And that is influencing behavior beyond anything we've seen in the past. It makes government influence greater in society, and that's how socialism operates.
Well, actually, Pat, you don't really have a problem with this mandated health care, do you?
Well, one of the big issues we have in this country is that we pay too much and get too little, as I've pointed out many times. We pay more for health care as a percentage of GDP than any other nation on the planet, and our outcomes, frankly, stink. Now, if you look at the data and you look at every developed country on the planet, the larger the proportion of healthcare spending that is public relative to private, the less the country spends on healthcare as a percentage of GDP. Those are the facts. Government involvement in healthcare, you may not like it, but it is the only way to get costs down, because you have a single buyer who crushes costs, gets admin costs down tremendously, and again, we may not like it, but if we're going to get off this unsustainable path of healthcare spending, it may be the only way to do it.
Toby, take that one on.
Well, you know, Mike's point is fabulous for the Veterans Administration, because that's a closed situation. Those are, you know, doctors that are on salary, nurses, et cetera, et cetera. But I think what he's really telling us is that is what the Obama agenda is, because this is just the first step. If the Veterans Administration, Mike, is your best example of how, you know, government health care should be, then what you're saying is you want a single-payer system that all physicians, doctors, surgeons are paid a salary, and that plan, my friend, is not only socialist, it's probably, inconceivable how bad that would be for the United States.
Let's do away with the VA. How about it? Look, here's the problem. You know this as well as anybody. What you don't want to talk about is the fact of price gouging by the drug companies, where they take a $2 bill, a $2 pill, and charge $50 for it. What we have to do under this plan is we have to get control over greed from the pharmaceutical industry, the very people that you believe are best for this economy,
and the way you're going to do that,
or the HMOs,
and the way that you want to do this.
Hold on, Mike. It's interesting because the government is pretty good at greed too, isn't it? Aren't we learning that recently?
Well, okay, this is how you upend the free enterprise system.
Brenda, here's the problem. Here's the problem. Here's the problem. Nobody wants to talk about the fact that we're letting an industry make $90 billion a year, the pharmaceutical industry, by taking a $2 pill and charging $50 for it. Now, let me tell you, the VA tells them you can't charge $50 for that pill. You have to control prices, and that's what we need to accomplish out of health care reform. Unfortunately, the Democrats aren't going to do it.
All right, Joey B., you got something to say.
In other forms of government, that's called price competition. The government is pushing the private sector to distort their prices in the private sector by mandating price on the top end, and then on the bottom, rationing the care to all citizens. So, of course, you're going to get a socialist-style medical system where they fix prices and they ration the care.
Right.
You get the government out of this equation, you get more competition, not less. The price is fair to everybody.
Yeah, we've seen that.
Oh, by the way, Congress would also be in the
we have the worst system in the world in what you just described.
I do.
Okay, hold on. I got to let Gary B. get in there. All right, Gary B., go ahead.
Well, wait, I like Mike's example, the $2 pill, as if it costs Merck or Pfizer $2 to develop that pill. It probably costs them billions to develop. That's why all our technology, medicine across the board, is exported out of the country, and that's why Canada can sell the prescriptions. Because they're going on the backs of the R&D that we spend. But in Mike's kumbaya world,
he
everything
suffers
should
from
be
hypertension
$2.
here, can't go across the border and buy the pill.
Mike, hold on. Give Gary a chance here. Okay, Gary?
I'm afraid he's going to stroke out.
Well, no, this makes him upset, and you know what? It makes a lot of Americans upset, actually, to be told what to do with their insurance.
He can go across to Canada and buy some hypertension pills for $2 rather than $500.
Yeah, and where do you think they got that R&D to make those hypertension pills, for crying out loud?
Yeah.
From us, on the backs of all
the problem, Brenda, you know the sad truth here, Brenda. For decades, wealthy inheritance babies have tried to scare the hell out of Americans by using the S word for socialism every time there's any attempt to have government involved. And I got to tell you something. It's impossible to believe that government could have done a more pathetic job than Wall Street and the corrupt banking industry than they've done for themselves running their industry.
Okay, guys, everybody wants in. Hold on. Quiet.
Brenda.
I know you're mad about this, and we've got the hypertension pills ready, but okay, Toby, you go.
Okay, Mike, take a deep breath here for a second, and let's go back to the original point here.
Fine.
Because you've devolved into pharmaceutical business, then you devolved into God knows what. The idea that we are going to take the American system and we're going to force people into a already broken system, it makes no sense from a variety of issues when the actual core problem is the business model is wrong in healthcare, which they get paid to perform stuff, and number one. And number two, people get this healthcare for free because it's paid without paying taxes on it, and they never see a bill. If you solve that problem, then all your fakakta ideas maybe would work.
Okay, hold on, Mike. This is going to be a really good show.